Well, major organizations like Doctors Without Borders and the Red Cross are largely credited with bringing relief to Liberia as it was ravaged by the Ebola outbreak. Yet some individuals in the Liberian diaspora also played an important role to combat the virus, one mission trip at a time. Monique John has a story.
Some say most Americans didn't pay attention to the West African Ebola crisis from 2014 to 2015 until people affected by the virus crossed over to the U.S. But there's a diverse group of determined Liberian American medical professionals who continually go to the region to help those grappling with the virus's aftermath.
We strongly believe that we are morally obligated to our people. It's like going back to serve my father, my uncles, my nephews, and my cousins. I bring them back relief to them.
Joseph Sacker is the chair of the Liberian Medical Mission. Based in the U.S., the mission has 50 healthcare workers who volunteer for patients in Liberia. Members come from all over the states, some even from Canada. The missions date back to 2011 and occur about every 2 to 3 years. 17 to 25 people are dispatched for each 2-week-long trip. Members were last seen in Liberia and briefly Guinea in March and April 2016. Sacker's colleague in the mission, Dr. Williametta Simmons-Bacasa, a clinical psychologist, says she was struck by the palpable trauma civilians still felt from the devastating disease.
There's this sense of desperation in terms of mental health need, and it's always great to be able to fill that void.
Dr. Bacasa recalls the cries of her patients and students.
I still have nightmares about it. I dream about it still. Some folks were terrified, when they would see, someone that got into an accident or was laying on the floor of, on the road. They thought, oh my goodness, everything keeps reminding me of the time that I had to clean up bodies.
In 2014, the Liberian Medical Mission joined with other organizations and medical and international development professionals of Ghanaian and Sierra Leonean descent. They formed the Diaspora Ebola Task Force. This umbrella group of almost 200 people coordinated relief supplies and helped send medical and tech workers to West Africa. Their goal was to mitigate the impact of the outbreak through building capacity on the ground. Dr. Duba Christopher Nyan, the director of the task force's secretariat, speaks to the hidden advantage in being a grassroots project.
We may not be the name recognized quote-unquote NGOs out there like Médecins Sans Frontières or ARC or the Red Cross, but we are the diaspora. We are from these regions. We understand the culture of the people, and so we can directly interact with them and understand their needs and responsibilities.
The members say they want to host more frequent missions, but few can take on the financial burden of paying for their own expenses to go on the trip, a bill that's usually upwards of $4,000 or $5,000. There's also the cost of maintaining the mission's warehouse that holds medical supplies that are airlifted to the region. In 2014, the mission sent $4.5 million worth of donated medicine and equipment to Liberian healthcare facilities. Shipment for a single 40-foot container costs over $7,000. On the next mission, Dr. Bacasa says the group will target violence against women and children exacerbated by Ebola. Dr. Nyan says the group also plans to extend its services to other countries and diseases like cholera, typhoid, tuberculosis, and malaria. The group is still seeking grants to advance their work.
If we can, as diaspora, African diaspora group, take our own funding, support ourselves to go into those countries, imagine what it could do if we have just $25 or $10 million to support our projects. We could do quite a lot.
Despite the challenges, the group insists that money, or lack thereof, won't keep them from going to the region again soon. Monique John for VOA News.